I think we're ready to start our presentation on virtual world and those technologies. I'd like to introduce our presenters. Jim Wallis, Senior Vice President with Preferred Family Healthcare in our Development Department. Dr. Matthew Hile, Missouri Institute for Mental Health. Did I get that right? Okay. And Jared Torbet is a Program Director with Emerging Technologies with Preferred Family Healthcare. And I think Jim's starting.
I'm starting.
All right.
And I've been given the great task of introducing our esteemed panel here, Judge Cotton Walker. And I think when we get to the point where we're actually talking, you can tell a little bit more about yourself. But Judge Cotton Walker is municipal judge in Jefferson City. Christie, most everybody knows Christie Becker-Markovich, the drug court administrator for the 12th Circuit, and Judge Andrea Vandeloecht with the 9th Circuit.
Sheridan County specifically.
Sheridan County specifically. So we're going to give a little presentation, and then we want to turn it over to our panel who has been using and utilizing virtual world technologies for the last several years to enhance and increase accessibility to their clients and their drug courts that they serve. I'm going to just go ahead and start out a little bit about myself. I am Senior Vice President at Preferred Family Healthcare. I'm in my 9th year working for Preferred Family Healthcare. Prior to that, I worked in juvenile courts in the 11th and 45th Circuit, and also worked for the state and Division U services for about 8 years. So I think I got a good taste of a lot of different public and private sector positions with working with this at-risk population, whether it's juveniles or adults. I want to start out with a quote, and I think it's really relevant, and this is William James, a philosopher, psychologist, and physician in the 19th century, and it just basically says, a new idea is first condemned as ridiculous and then dismissed as trivial until it finally becomes what everybody knows. And I'm putting that up first because some people in this room may be a little skeptical about what the heck are we trying to do and how is this replacing, and does it replace or does it enhance? And I think that's a real relevant, and hopefully there's some good questions generated after our presentation. I hope they're asked because this is a new technology, and I think some of the outcomes you'll see are going to show some good data in terms of what we're accomplishing. But I did read up as I'm getting ready to do some of my presentation on some journal articles on telemedicine in the 80s and 90s, and very similar observations were made about that technology. So virtual world counseling, Avatar. Anybody see the movie Avatar? Pretty sci-fi, holy crap. Anybody ever been in Avatar in a virtual world? Raise your hand if you have. Oh, a couple people. For the older individuals in this room, anybody play Pong? Come on, come on. For my age group, anybody ever play PacMan? I better see every hand raised in this room. Okay, when you're playing Pong back in the 60s and 70s, that little stick, that little block, that was your avatar. Okay, that little stick was your avatar. And as you're playing and that ball's coming toward you, and you got your little joystick, and you're twisting it, and you're using your body language, and you're moving, and you're kind of getting nervous, and you don't want it to go through, that was your avatar. In PacMan, you're the little guy eating the dots, and then the ghosts turn blue, and you're eating the ghost, and oh, start flashing, and oh, what's going to happen? And then you're getting nervous, and then you're running from the ghost, and that's your avatar, that little guy with the crunching up all the dots. So now, after billions and billions and billions of dollars have been sunk into virtual gaming, your avatar is a real-life person, and Jared's going to give a great demonstration on what that looks like. And you've seen the gaming, you've seen the commercials, Grand Theft Auto, and Help me out, Jared. Another great gaming game.
Call of Duty.
Call of Duty. You see all of that. And that's fun, and that's exciting, and all our kids want the games, and they cost a lot of money. But we have utilized this gaming technology to create a forum, and I'll talk a little bit about our history, but gaining accessibility, especially to rural courts, for treatment, for education. Virtual world counseling is supported by research. Even before we really got into virtual technology in 2007, Dr. Zach Rosenthal from Duke University had a virtual world platform where he walked addicts, crack addicts specifically, through a virtual world crack house and put them into high-risk situations that they typically relapsed, and at the same time had a counselor talking about those relapse situations, basically walking them through the practice field before they go out into the real world doing real stuff, and that went well, and that journal article is available. So it's been around for a while. Our virtual world counseling that we're going to talk about specifically today, we're going to focus on Portal DWI and that education program, but we started our programming in 2008 with Portal 1. It was a Missouri Foundation for Health grant, working specifically with adolescents that were in residential rehabs, and then they went back home. And sometimes back home was 50, 60 miles from regular traditional treatment. And maybe they could get to regular traditional treatment, or regular traditional treatment could get to them one day a week, but they needed more than that. And this was a venue that allowed them to have more than that. And the outcomes that we gained from our Portal 1 Missouri Foundation for Health grant allowed us in 2010 to get Portal 2, working with adults that were leaving rehab, going back to their home communities, having accessibility issues. And that was a SAMHSA federally funded grant. 2011, we did a virtual tobacco cessation grant. Justin up here is our virtual tobacco cessation counselor. And it was geared, through Missouri Foundation for Health, it was geared for college students specifically. And while the colleges really love the idea of helping their students quit smoking, we found the true hard fact that college students were just beginning to smoke, and they're just beginning to drink, and they're having fun, and they really didn't want to quit. And so engagement was a difficult issue. And Justin and his team made a proposal to the Missouri Foundation for Health in the last year or so to open that population up to anybody in the Missouri Foundation for Health catchment area, and be able to provide that smoking cessation for free. And the numbers have really skyrocketed. And it was really cool. I was at a St. Louis Mental Health Board meeting earlier this week, and one of our funders came up and told me I'm in my 4th week of virtual tobacco cessation, and I'm like, what do you think about it? And he's great, and Justin's great, and Justin doesn't even know who I am, and it's really great. And now Justin does, and I said, you better make sure he's happy. Make sure he's happy. So in Franklin County, the 20th Circuit, we have a Children's Services Fund, and our first official sustained funding is working with, if some of you, anybody from the 20th Circuit, Franklin County, know where it's at. It's a huge county. So our offices are up in Union. Sullivan's 45 minutes away. Maybe we get a counselor down there one day a week. Those kids are engaged 2-3 times a week through the virtual counseling. Portal Plus is a program that we're talking, and I'm going to run over here because I don't have this memorized and I failed as a presenter. But we're working now with drug courts, enhancing and expanding their treatment programming with those drug court individuals that have accessibility issues, and we're working with the 1st, the 3rd, the 9th, the 12th, and the 41st Circuit. Anybody from those circuits here today? Got a few of you. So. And I know you're there. I know you're from there. and that is going great, and I think that'll probably be talked about a little bit. And then our Portal DWI program, and that's our education program, education specific with first-time DWI offenders. And our goal, and really Judge will hopefully mention it, they came to us with a need and a barrier, and they would like to see second and third-time DWI offenders reduced, and they would like to do something to enhance the services with those first-time DWI offenders. And they created it, and we're in about our 12th month of gathering data and outcomes, which Dr. Matt Hile will talk about its effectiveness. I see a hand raised back there, and we're going to leave about 15 minutes for questions, just to kind of keep the flow going. What's that?
Virtual board is different than like Skyping and stuff like that.
It is, and you're going to see a demo right now and that's going to be the coolest thing. The question was, because I have to say this for the videographer back there, and you all are going to be famous and in Hollywood, we figured it's a Friday morning and we're not going to have the greatest turnout, and I'm blown away by this turnout, and I really appreciate it. But we are videotaping this, and it will be on our website. And so if you have individuals and you thought, hey, that was a halfway decent presentation, I'd like to let somebody else know about that. Hopefully in the next few weeks, and we're going to send a letter out, we'll have this on our website and the link, and you'll be able to see that. But specifically, the question was, is virtual world like Skype or teleconferencing? And it is not. It is somewhat different, and Jared is going to give that demonstration right now. So I'm going to turn it over to Jared Torbet.
Okay. All right, so I want to give everybody an idea of what the virtual world really looks like. So let me start with logging in to our 3D virtual world, which is all internet-based. We have moved to a 100% internet-based, secure, HIPAA-compliant platform. So our consumers do not have to install anything on their computer. They just open up a web page and go. So the world I'm going to show you is our Portal 2 world. And our Portal 2 world is a Jim, you didn't talk much about that particular grant, but that program isn't necessarily what we're highlighting, although I'm going to show you its world. And I have a couple of people from the audience that is participating in this as well. And we have a few people from many, many, many miles away from here that are joining us today as well. So when we first log into the world, we have username and password, just like any kind of secured platform. And it brings us to a virtual dressing room. Now, this is where we get to pick our avatar. We can choose whether we want to be male or female. We can choose from a variety of different looking avatars that we feel like maybe best represents us, or have, how we want to be represented in the virtual world. I usually pick this guy. I think he looks more like me than any other avatar in here. And he's got some pretty jamming clothes, so and a little shine to his shoes. So I'm gonna choose him, and this is the typical outfit right here I choose. And for me personally, I don't want to change my avatar because I want people to kind of know me by a look. So not only is it going to tell them who I am, but it's also that same look, so I'm not really changing much. Now at the same time, some of the counselors and a lot of the clients, they like to change at least their outfit on a daily basis because that's more familiar to them. That's what we do in the real world, well, most of us. Okay, so as we enter this world, we start off the same point that everybody else starts off. This is called a spawn point. It's just kind of the entryway into our 3D world. And we have 3 different rooms in this particular world. So the first room I want to show you, and I just kind of want to help you understand how we move around. We can use laptops, standard PC computers, really any keyboard with arrow keys will work. So I'm going to use my arrow keys, and I'm just going to move around. I'm pushing forward to walk forward. I'm pushing the down arrow to walk backwards, the left and the right arrows to look around. I can even use the mouse to kind of customize my view. So it gives us the ability to even enhance our view. We can't really do this in real life, so it's a bonus in the virtual world. And we can walk about, we can interact with things. There's a chair. We can sit down in a chair, just like real life. And these are very, very basic things, but they're things that if we couldn't do in a 3D virtual world, it wouldn't feel real to us. And the idea is that the more real this world feels, the more we're going to feel like we're actually in the presence of the individuals that we're speaking with. And that's really, really, really important in counseling. You want to feel like you're with your fellow person in recovery. You want to feel like you're physically there with your counselor, and there's not any kind of a barrier between you. So by making the virtual world not only look more real, but also have the same functions that we can kind of do in daily life, it's going to feel more real, and it's going to remove that barrier of geographical distance between us and the person that we're trying to connect with. Okay, so since we don't want to walk around all day long, actually I'm gonna see if Casey will join me. Hey Casey from OSCA, will you log in? So a couple of the other rooms that we have, one we call Expo, and Expo is just this huge group area. We got lots and lots of seating. We have an educational area. If everybody can see this this big screen here, we can kind of hone in on that, and we can control what's on that screen. We can show different pictures. We can even post a PowerPoint presentation to flip through automatically. So we can bring in group materials into the 3D virtual world. Now, this particular screen is going to limit me a bit when I demonstrate this, because this is a very square screen, and all your modern laptops that we use and what our world is set up for is kind of a wide screen. And but we have more room on the right-hand side. There we go. Who joined me? Is that Casey? Okay, thank you, Casey. So on the right-hand side of the virtual world, there's almost as much room on the right as you see the distance of the virtual world being. There's quite a bit of room over there. And we can use that space to pull up documents. So we can be in the virtual world, and I can use my mouse here, and I can, let's say, click on a picture or click on a series of words that we have posted, a sign, anything like that that we want to put in, we can put in. And we can attach a hyperlink to it, which means you click it, and then over here it'll pull up a web page that doesn't cover the virtual world. It just posts right next to it. We can have PDF files, all kinds of, for any clinicians in the room, we have, we can put any group materials next there that we want to, or we can just have a website pop up, and we can use that in our counseling. All right, Casey, you following me? Let's see if you can keep up. Now, I don't want you to make fun of the way I run. That's one thing I need to talk to the programmers about. There we go. So this is what it's like to be in the physical presence of somebody else in the virtual world. Now, one of the basic functions of this is communication. That's the whole point of this, is we can communicate with one another. Now, if I pull up my list of users, I see that we've got guest 2, which is the login that I created for Casey, and then you can see me in there. So anybody that's in the room, I know that they're in the room. I also have a chat box I can pull up, and chat just means text, typing, back and forth. Most of us have done that, live, instant messaging. And that's one of the forms of communication that we use, and it's the most common one, and there's reasons why, which if we have time we'll get into later. So I'm going to say, hello, Casey. And we'll see if Casey gets that. Did Casey get that? Let's see if she replies to me. All right, so now Casey and I have officially communicated within the virtual world. Now this is how our groups work. This is how our individual counseling sessions work. And we also have, we supply all of our consumers with a headset that looks like this. I know I'm in the dark, but it's a headset. It has speakers for the ears. It even has this cool microphone here. And it plugs right into the computer by USB. And what happens then is I can, if you see this icon, can you see where my mouse is at? You see that yellow icon? Well, we can click on that. We can activate an audio component. And so, which means if I have my headset on and Casey has her headset on, and we click audio chat, her and I can verbally communicate through the virtual world and see each other in real time. All right, I want to take you to one other place. This is our beautiful room 2. It's got some cool stuff, water features, waterfalls, campfires, all kinds of stuff. And there's Casey. All right, so Casey at the very top. Good job. Okay. So at the very top, do you see these buttons up here? Okay, these are just little links to take you to a certain area. So it's one big room, but we have kind of these different areas, and we don't want to walk around all day. We want to focus on treatment. So we made little shortcuts. So Casey, click Cave of Wonder. And this is where I have some of my staff sitting waiting for us for this presentation. They've made themselves available to chat with us today, although we won't be taking much of their time because we don't have a lot of time today. So I'm going to open up my list of users, and I got a whole bunch in there. You see that on the left? That's everybody that's in this room right now, this entire room. And then on the right, I can start chatting. Now, this is a group that's essentially in progress right now.
Where are these individuals at?
Well, these individuals are spread out. We have one right now that's in Iowa. We have 3 individuals that have logged in from Kirksville, Missouri. And of course, we have a couple that are logged in, right now from the lake. So this program is available globally. I mean, we could have somebody in China. We could have somebody in the Netherlands logged in right now, and nobody would know the difference. And there's value to that. And well, I better not go into that. That's a long string.
That's a good question for later.
Yeah, good question for later. Somebody remember that. Okay. So there's a group in process here. So I'm just going to kind of let you see how the dialogue is going. So this is a therapeutic group that it's a mock group that they're conducting just to kind of demonstrate what it looks like. And this is what treatment looks like in the 3D virtual world. Okay. Now we can also do one-on-one individual sessions. So I am going to go back to room 1, and Casey, you're welcome to join me. And my counselor is Heather. So I'm going to go to Heather's room, where she's a good counselor because she's there when I show up. There, Casey. Okay. Casey, I'm going to be a gentleman and let you have a seat. And my counselor has greeted me, so I'm going to greet her back. Hello, Heather. So Heather, being an individual in an individual counseling session, I kind of surprised her by having Casey join us. So she may be wondering whether she's conducting a group or an individual counseling session. Doing well. Can we talk about a trigger I had today? Now, we're not going to go into that because it's my business, not yours, and we don't have time for it. So these are the basic functions. This is the basic look of the 3D virtual world. We develop our own world as far as what it looks like. We made this cloud. We built those chairs. We've created all the maps, all the areas, all the links using a particular software that we invested in. And so we get to change the look of it at any time, and we can modify the look. We can modify the functionality. And the software is built on a platform that is extremely expandable, and we can integrate almost anything into it. And we continue every day to push the software as hard as we can, and to push ourselves to learn as much as we can about how to program in this environment so that we can make it look more and more real, and we can make it more and more functional. And eventually, it'll have functionality that cannot even be brought to a traditional counseling setting. We'll have access to limitless amounts of information at the click of a button. have access to communicate with individuals all over the state, the nation, the world. That's right there in front of us. Things that we can't do in a brick and mortar building today. So that's the basic look, and I hope you enjoyed the demo of our 3D virtual world.
Thank you, Jared. And I'm going to turn it over to Dr. Hile. I just want to say, as you're looking at this, I hope you kind of got a taste of the Wonder Cave and Heather's Cloud. And really the one thing that we wanted to show is as the individuals join us, and I think there was also an individual from Columbia, Missouri on. This could be statewide, this could be out of the state, depending on the needs, depending on who the group we're serving particularly is. And the nice thing about the platform is we can create a platform, you know, whether for that specific population. We've got some dialogue going on right now with the program in Cincinnati that treat pregnant opioid women, and their feedback on what they want their platform to look like, how formal, how informal, is things that our builders can create. And as we talk about maybe at some juncture serving, you know, kids these days can, I've got a 3-year-old that can log onto my computer and click and double click and right click, and he's got it figured out. It's just innate. And what does that platform look like? Maybe they want to have their counseling session on the moon one day. Maybe they want to have it somewhere else another day. Those type of environments can be created that are comfortable for not only the client, but also for the referral source that says, hey, I prefer our platform to look this way or that. So just throwing that out there. Dr. Matthew Hile is with the Missouri Institute for Mental Health, and he has agreed for the last 12 months to gather some good outcomes for our portal DWI, and he's going to share those outcomes, and I'm going to turn it over to you, Doc.
Slides. Oh, am I ready?
You just click.
Ah, there we go. Okay. I'm the Director of Behavioral Informatics at the Missouri Institute of Mental Health, which is now part of UMSL, part of University of Missouri at Columbia for 45 years, and I've been with UMSL for the last 5. What I'm going to talk about is the assessment system and the processes that we have built around this environment for testing folks as they go through Portal DWI. The process is people sign up for the system. We get a notification of that, and they are sent an email with log-on information. They respond to that information, and they start doing a variety of assessments. We aren't going to go through the assessments per se. We're going to talk about some of those as we're talking about the results. But part of that assessment process is to provide individuals with this personalized feedback report. So based on an individual's responses, this report compares their responses with other people from around the state and around the world. It lists the risks that they experience for their particular level of substance misuse. It provides information that really tells them what they're doing. So one of our favorite slides for folks is it will tell you how many drinks you have drunk in the last month, how much that's cost you, how many calories you have gained from that, and how long you have to exercise to get rid of your calories. People find that really kind of informative and terrifying at times. We talk about their level of risk, and we compare that with state and national norms. A lot of times what people are saying or thinking is that the way they drink is the way everybody drinks. It's the way all their friends drink. So obviously, everybody drinks a 6-pack of beer Friday, Saturday, and Sunday night, because all my friends do. So what we do in this program and in this report really is to compare them with what people really drink. And they begin to start seeing the discrepancy in their behavior and in what happens. The other thing that we do is we provide specific behavioral recommendations for how they should go about, or how they can go about changing their behaviors. And this is based on their interest and motivation to change. There's a theory about this called motivation to change, readiness to change, And if you provide people with advice about changing that is not where they are, they're going to ignore you. So if someone doesn't think that they have a drinking problem, and you say, okay, you need to do this and this and this, you need to quit drinking, you need to quit hanging out in bars, you need to do all that, they don't think they have a problem, they're going to ignore your advice. If what you start with is having them think about those drinking behaviors and how they are impacting their lives, they can start looking and seeing the discrepancy in how they want to behave and what they would like their life to be like, and start seeing some of the problems associated with that. So the advice is really tailored and specific to that particular individual based on their responses. So we do all those assessments. All that is provided before they start the services, before they start the virtual world. They go into the virtual world and they have all of their sessions. When they're finished, we repeat a number of those assessments. And then we repeat a number of those assessments 6 months later. So we have data both at discharge and at 6 months. People are completing these on their own. So we've had about 50 people so far participate in Portal DWI. About half of those, a little more than half, have been discharged. We've got 10 people who were discharged or started treatment 6 months ago. So we have 6-month data on 10 people. So it's not a really huge sample at this point. Most of the folks are male. We see that the age range where we have most people is 21 to 30, although there's a bump in the 41 through 50-year-olds. For the most part, people have had at least one DWI. We've got a couple at 2 and 3. One of the questions that we ask them, one of the questionnaires we ask them, is a satisfaction questionnaire, an attitude questionnaire about what it is they think. And these are the results from that. Now, if you look on, so this center point here is neutral. Things towards this are agree. If you're out 2 of those lines, you strongly agree. So up there in terms of less likely, what that question is are you less likely to drive after a few drinks after completing this course? And so they strongly agree that that is the case. They're likely to recommend this program to other people. It's changed their outlooks. And so these are things that people are really strongly agreeing to do. One of the things that I thought was most interesting is one of the questions is whether they are able to be more truthful in Portal DWI than they would be in person. One of the advantages of these kinds of systems is the anonymity, and you're not sitting in front of a real person telling them the things you're doing, so you're able to tell folks without feeling that kind of social pressure to lie. So we looked at and this will be the most complex and bizarre chart that I show you. We looked at their risk levels from intake to discharge. And what we see is that over the course of their services, they're lowering their level of risk. And this is based on the World Health Organization's ASSIST assessment. So this is an internationally validated assessment for substance misuse risk. One of the interesting things that we see there are these 3 guys. These 3 people at the beginning of services said, I don't have a problem with alcohol. I don't have any risks. I'm fine. At the end of services, they say, oh, well, I have a problem. So that the services have made them both comfortable to be able to respond to folks and let them know that they've got this difficulty, and also to move them into that next stage of change where they really can begin to, they've realized that they have a problem and now they can begin to make changes associated with that. So while it makes our results look not quite as good because these are people that didn't have a problem to begin with and do have a problem afterwards, for them, that's really a positive outcome. So what do we get in the way, other ways of outcomes? This is a graph of the number of people at risk. And this is again based on this normative information with the WHO's ASSIST. And what we have is a significant reduction in risk levels from admission to discharge. The 6-month follow-up for those 10 people also dropped because the number is so small. It's not significantly different than at discharge, but it is clearly also significantly different from admission. There we go. Now this is the Audit See, which is used widely for assessments for substance misuse. And these are questions, and if you look at those little whiskers, they'll tell you whether or not there's significant differences. So this first question is, how often do you drink? And the ranges are, 1 or 2 days a week, 3 to 4 days a week. And you see there's a reduction in the number of days a week that they are drinking, but there is no real difference across the scale. However, the drinks that they have on a typical day, we're seeing significant reductions from admission through discharge, and then for the last one, the follow-up was actually a 0. So they have reduced their level, the number of drinks that they have on a day, to a level that is not risky, which is 1 to 2 drinks a day. Binge drinking is the 4 or more question. This is asked 4 or more for women, or for women, 5 or more for men, based on the NIAAA binge drinking guidelines. And you see again a significant reduction in the number of binge drink days from admission to discharge. And again, the follow-up is the same as the discharge. And their overall score for the assist, or the Audit See, again shows that significant reduction from intake to discharge and follow-up. Some other outcomes associated with this is that there are fewer drinking days in the last 7, so they aren't drinking as many days. There are fewer, and when they do drink, they are drinking fewer drinks, which is also what we want. And one of the things is that they now see binge drinking as more risky than they used to see it. Part of that may be because they're in a DWI program at a court, and that seems a little risky to them. But there are other things going on with that. So they're beginning to realize what's happening with their issues. And that's me.
Thank you, Doctor. I'm also the official time filler for the editor of the videography. But I'm going to turn it over to our panelists. A couple of things with Portal DWI. As you saw some of the data, we're into this about a year. Ultimately, our goal after 2, 3, 4 years is to be able to show that there's a true reduction in these individuals with their first-time DWIs to second and third. I mean, that's ultimately what we want to be able to reflect. The Portal DWI program is a 10-week program. They get 1 individual session. It's a 10-week education program. They get 1 individual session at the beginning, 8 weeks a group. That group is going to consist of clients from Jeff City Municipal, and we've actually had several referrals from Osage County in the 20th Circuit. The prosecutor there and the judge there has referred several with good successes. And those folks might be neighbors next door to each other, and they don't realize that. It's a private pay program. It costs the participant about $375 for the 10 weeks of counseling, which, and if you do the math and you do real counseling out of pocket, that's a steal for them. And we're so grateful. Brian Stumpy was going to be one of our panelists. He's the Jeff City prosecutor. He came to me about actually a year and a half ago, and said, hey, let's do this. I'd like to do something more to enhance what our first-time offenders are getting. He was to be here today. Not only did he have a new baby, number 6, yesterday, he's also got a lot of other business going on and couldn't make it regretfully, but we do appreciate his input with this program. But in lieu of that, Dr. Cotton Walker, Judge Cotton Walker is here today to talk a little bit about his experience. I'm going to turn it over to you. Thank you.
Very much. Thanks, Jim. And I'll stay seated if that's okay for now. Brian Stumpy is my prosecutor, and he does send his regrets. His not being here is sort of literally a matter of life and death. As Jim mentioned, his wife had a baby, but he's also serving as a baby born yesterday, serving as a pallbearer in a funeral today. So both ends of the spectrum. But as Jim mentioned, Brian and I discussed the need, and Brian approached Preferred Family Health, and we've worked with Preferred Family Health to develop this program, and worked with them collaboratively to administer it. In fact, we've developed the forms that we use for the court from scratch with Preferred Family Health's help, and we've modified the form since we started for a reason I'll go into in just a moment, and we've even talked about the world that Jared showed you a moment ago, and we went out for I guess you'd call it a training session or an exhibition. I'm a little disappointed, and maybe Jared has this up his sleeve still, that he didn't show you that you can actually fly in the virtual world too. So if he gets that opportunity, he kind of gave that as a little nugget at the end of our training session where we went out, just so we know what our participants, our defendants, are experiencing when they choose to go into the program. And I think that's important, and I kind of start off maybe with where Brian was going to talk today. I talked with him leading up to today because the prosecutor's perspective is a little bit different than the judge perspective, and while I'm a former prosecutor, that goes back a couple decades, so I'll give his points now and then kind of give the judge perspective. And Brian would say that obviously one of the objectives was to offer this program to first-time offenders, and that's different than often the drug courts and maybe even some other DWI courts and referral programs where you're catching a subsequent offender or you're having a subsequent offender participate with alcohol, especially, he felt, and we've discussed the need to educate, as this program does, the consequences of your actions beyond just what happens in court, and offers them an alternative, if you will. And of course, courts and judges from time to time are looking for those alternatives so that we can help the recidivism rate. But so I want to talk a little bit about what the process is in our court if a defendant has a DWI offense, and it's typically then with defense counsel. They approach Brian, and one of the things that Brian tries to do is work with the qualifying offenders to get them into the program promptly. So that means get them, get an entry of appearance from an attorney, or perhaps it's a defendant who's not represented, although I don't know that we've actually not had a defendant who's represented by counsel participate in the program or choose to, but I presume it's possible. Get them to a plea situation pretty quickly, and he would state that as a prosecutor, he does use this as a plea bargaining tool, giving this program as an opportunity for a defendant to have an alternative to the standard conviction with fine and probable jail time attached to a DWI offense, which is often what would occur in a first-time offense in Jefferson City Municipal Court. And he gets them into the program so that they start with that education, and so that they get that opportunity to learn the consequences of their action and try to attack their offensive behavior, which in this case was drinking and driving, as soon as possible. So, and Brian and I have interplayed back and forth about what those qualifying factors are to have him offer that, or to have me approve a plea, as judges and prosecutors sometimes do, on a guilty plea on a DWI offense. And typically in our court, what we've kind of identified as qualifiers is it's a true first-time DWI. I noticed the statistics from Dr. Hile. There were a few who maybe had a subsequent DWI, and that could be from my court, or I guess could be from Osage County. I'm not completely sure. But one of the things we try to look at, and Brian qualifies before making a plea offer, is that we're dealing with someone who's a true first-time offender. And in that, we often will look at the existence of other alcohol-related offenses, whether they have maybe had a minor possession charge when they were under 21. We also typically look, and I guess this is true for any probation-type situation, we look at whether the BAC level was a reasonable level, so that we think education can still still get to this offender or this defendant. And then a cooperation and attitude both at their law enforcement contact and in the court process. So those are sort of qualifying factors. Jim mentioned the cost to the offender, $375, and that's an advantage of the program that we see, as many of you all know as court professionals. Funding is often a problem. We don't see that as a problem or a roadblock to our court using the program. I would say that we probably have had some fail to, choose to, or be unable to pay that program cost, and then they come back on a on a probation violation, in essence, if they don't complete the program. But in reality, again, as Jim mentioned, $375, you're getting 10 or more counseling sessions, individual and group, and typically the way our court handles it is you're getting it on an SIS, or a suspended imposition of sentence, so you're not paying a fine. The fine in our municipal court is limited at $500. Other municipal courts, some could go as much as $1,000, but the trade-off is about equal in that you're paying $375, but you're not paying a $500 fine. Now, we also, with our probation orders, have a couple other hoops for the offenders to jump through, which includes typically a victims impact panel and community service through our local agency. Capital Area Community Service Agency administers our community service in Jefferson City in the 19th Judicial Circuit. We are a part-time court. Mr. Stumpy and I are both part-time judge, part-time prosecutor. That basically is every Wednesday of the year is our court. And that's relevant because we don't have staff to otherwise administer or to supervise probation terms, which include community service or what have you, and a program like this. We don't have the funding or the staffing to supervise and make sure that people follow through. But this program takes care of that, and it does it in this virtual setting. The other thing that's important, I think, about this virtual world is most of these, being first-time offenders, they're dealing for the first time in their life with a loss of their privilege to drive, and it's a no-brainer to think, well, this is an alternative for them to get to and show up at a counseling center or a counselor's office or at a program or you know, for example, the SATOP program, they go for an evaluation, they go then for follow-up, either weekend intervention or whatever the analysis is for the individual offender, and this doesn't require all those steps. If I can take just a second, and I'm not going to talk much longer, Jim. Okay. He's below the table. He's giving me the 2 minutes. Or a curveball. I'm not sure which that is. If I go beyond 2, it is a curveball to him. Just a little feedback that I've gotten from, and Dr. Hile's given me some of the actual anecdotal feedback that the offenders put. I didn't see the charts, but I did get to see some of the comments, but also from defense counsel and participants. One of them is that it is not a SATOP qualifier, and it is not our intent in our court in designing the program for it to be a replacement to that. In fact, typically in my court, we don't require SATOP as a condition of probation anyway. To me, that's a license issue. While it serves its purpose and has its value, that's not something that we typically do as a probation term. But some defense counsel in particular have given a little negative feedback on that. They're like, well, why am I having my person do another program? So that's something that's happened out there. And then the cost of the offender, a few of them have identified that as a roadblock. I would say that those who see that as a roadblock are the ones who didn't pay to get in the program and go through the program and the counseling about the overall cost to their offensive behavior. So at $375 versus the fine and probable jail time, I see that as a fair trade-off. So I'm happy to take questions as we go, but that's kind of been my experience, and we've had some good success with it. We're a year into it, and so we really only have about a half dozen who've gotten all the way to that 6-month beyond. One more thing, I know one thing we did is in developing the form, and the change that we made to the form was when we first put it out there, it's It's a 6-month process from date of plea to completion, and then 6 months beyond that to get that final evaluation that you're supposed to give back. When we first set it out, we said, well, you have to complete it in 6 months, and as offenders often do, they said great, and they marked their calendar for, I assume, 5 months and 15 days and said, I can complete 10 sessions in the last 15 days. So in our contract with our offenders that we have them sign, we modified it. A term of the program to successfully complete is they have to sign up exactly 3 weeks after within exactly 3 weeks of their plea. Again, we're a weekly part-time court, so we'll get that report on that 3rd week if they're not signed up. Then they have to complete their first session within exact number of weeks, and then they have to complete the final session within the 26 weeks or half a year. So that was one modification that we had to go through, that our offenders taught us that we needed to make the change. So,
and I think the other modification is when Osage County knocked on the door, all of our forms said Jeff City Municipal,
Yeah.
so we're like, let's make these a little more general. So today, whatever county or whatever municipality, we have the forms, and the offender could be ready to go tomorrow. And that's just a lesson learned. I'm going to turn it over, I believe, to Christie with the 12th Circuit. You want to?
Okay. The 12 Circuits program's a little different than Portal DWI. We're under the Portal Plus side of PFH's programming. And what we found, first of all, we've been doing it about 1.5 years in our circuit. Initially, when we started it, it was based on the fact that in 2 of my counties, our traditional treatment providers' services had been reduced greatly down to 4 hours per week available in those counties. So we wanted to look at what could we offer to ensure that our participants were still meeting the program requirements and still obtaining that treatment component as well. We got together, sat down, started developing, and once again, ours too has been a back and forth working with Jared, changing some process on referrals. Originally, we were like, had to have a minimum of 6 months left in the program, but then our participants who have been in our program for 12 months, 14 months already, we're seeing this as a sanction instead of an enhancement to their services. So we went back to the drawing board, and now at the time of inception into our program, every individual that comes into our program is screened at that point for Portal as well, no matter if it's in Warren, Montgomery, or Audrain. We have been very blessed to, we have a great PFH counselor on our Portal program who has worked diligently and in a collaborative partnership with our traditional treatment providers. She has open communication with them. They are both working for the same goal with that client. So therefore they're not hearing 2 different things or being slammed with different assignments through treatment. She shows up for our process. We only require her to come to our staffing once per month. We have our own database that her notes are immediately entered into that all of the team can see as well. And she, of course, emails us or text. And our participants, our program, they are given the laptops, an air card, and based on a lottery system, there was a phone. Now the phone was not to make calls, but it would send them surveys or I don't know, like little treatment statements, things like that, just as a reminder, hey, we're thinking of you, or hey, we want a survey today, how are you feeling, as another way to reach out to our individuals in our most rural areas. If you're not familiar, Audrain, Montgomery, and Warren are all very large counties, but we have many individuals who are having to drive 45 minutes, 50 minutes to a traditional treatment site, to their drop center, to court. And so this was a way to keep them in tune with their recovery community without having to leave their community or to find someone to bring them 45, 50 minutes into the community. It hasn't been perfect. Some of the issues that we were bringing up, and I think Jared kind of skipped over this because he's more the techie guy, and so us in the drug court world, first thing you want to know is, well, wait a minute, if I'm in an individual, is everybody seeing my individual? They're not, that's closed. I know, like when he walked in and he said, oh, I brought a guest. Well, only the counselor and that person, the consumer, can see each other's information on that. Now when it's open, everybody, it goes around. Another thing is, Casey wouldn't have been in and would never have gone in and say, hey, this is Casey. Every avatar, they get to design their own name. It has to be an appropriate name, something fun, something to, you know, that they're going to be known by. So this way, the counselor knows who they always are because your counselor knows your avatar's name. But everybody else sitting around the table doesn't. And for small communities where there may be cultural differences or other things going on, or they can then go into these groups, be who they want to be, and not feel like they're being judged and they're going to go down to the corner market and everybody in town's going to know what's going on with their business. So that has really opened up a lot of opportunities for sharing and I think recovery for our participants. And the plus to this that I don't think any of us saw, for us, we especially with our felony DWI core program, we have a lot of older gentlemen, farming areas, who have never had a cell phone, more or less computer or internet. So it's very interesting watching our 50 and 60-year-old men for the first time, you know, what's here, this button, you know, and just learning that. And so they're learning technology at the same time that they're getting treatment. And they're excited. They're excited about being able to talk to their kids or their grandkids about it. And I know that's not really part of this, but it's part of their recovery, about being excited about being part of something. And so that's helped us on both ends. Actually, one of my counselors is here from our circuit, who is a traditional treatment counselor, and he works in conjunction with Mandy, our counselor, and I mean, I believe it's gone well, don't you? It's so, well, pipe up. But other than that, and for ours is on a grant, so of course for our individuals, we don't have a cost for this, nor do the participants. But that's on the felony drug and DWI side, not on the municipal portal DWI side.
And Christie threw out just a couple things that every participant gets their laptop and a phone, and that's the beauty of those SAMHSA grants, the money, we're able to spend it. And we're actually writing another one right now to hopefully sustain and enhance the programming. So that varies from funding source to funding source. The counselors' names, the client makes their own name up, the counselors keep their name, so then like Jared said, you know who's coming in, you know who's sitting there. And I agree completely with Christie that job skills piece, learning technology, and whether it's an older client or younger client, then learning how to surf the web and look for job opportunities. A lot of things can tie into not just being in the virtual world, learning those skills. So thank you, Christie, and I'm going to turn it over to Judge Vandeloecht, and thank you.
We started Portal, and we actually started with Portal 2. It would have been in July of 2011. We had not had a drug court previously, and we wanted to, well, I wanted to start one. We live in a very rural county. There's about 8,000 people total population. That's everybody in our county. And we do not have a service provider in county. In order to receive any kind of counseling services, our participants would have to travel anywhere from 20 minutes to an hour to reach a facility. In starting drug court, I called several providers who were supposed to be, we were supposed to be in their catchment area. Nobody ever could tell me exactly whose catchment area we were in. I did not receive any calls back except for Kathy Hoppe, who called me back and said, let's figure out something. So we started with the Portal 2, and we have a large age range. And speaking with the older clients, they aren't real excited when you hand them that computer and say, this is how you're going to get your counseling, because that's the only counseling we have, with the exception of a group that's handled on our drug court day by our counselor that comes. And she's the only counselor that comes to us. She also does the portal with them, so they're dealing with that counselor and one or two. I know they deal with you, Michelle, but do they deal with Brenda too? I'm not really sure.
Not on a regular basis.
Okay. And so we have two counselors, one of which who is there every week. We had some resistance in the beginning because it hadn't been done before in drug court. Not only resistance from when we were trying to sell this to Osage. This is what we want to do, and they're like, right, sure. But also with people you would tell in the community, we're like, hey, this is what we're doing, and they're like, that's not going to work. That's not going to work. It's going to be somebody else doing their counseling sessions. They're not going to show up. And we did early on, one of our first clients came onto his session, and our counselor, we've gone through 2, and they've both been fantastic. I cannot say enough about the counselor that's been with us through this. She picked up on it immediately that was not him. She's like, this is so not him. Because the language they use, this was somebody who had difficulty spelling anything, and he was just spelling stuff, and he was using LOL, and I mean, just, she was like, this is not you. She said, you know, she confronted him, and he admitted it. But that was interesting to see. And then we had one just last fall that the counselor picked up on right away that, again, this was not the person. This is not how they talk. This is not the language they use. And it took her a while to admit it, but she did admit it, that it was not her. So it's interesting to see that these counselors have that kind of rapport with these people, even though I don't think they've ever seen Michelle in person, but they can pick up on that. And they have that kind of ability to communicate with these clients and know them that well, even though they don't meet them in person sometimes. So that's refreshing to know that that bond is being forged, even though they don't have that face-to-face contact. I do contend that we do need that in some form, and we get that with our once-a-week counselor, but it really is nice to see that they can connect on that level, even though they're on a computer.
Thank you, and I really have to give so much credit to these folks. In public, I say they're the champions of virtual world. In private, I say they're kind of the guinea pigs, because they really are. There's been some bumps, and this is new technology. This is a promising practice. It's a promising practice, and our goal is to provide evidence-based treatment in this modality effectively. And as we go, we learn something with the form. We learn the stranger's in pretending to be the avatar he's not. And so as we adapt to that now, every client has to have a camera on their computer to where the virtual world counselor, if they suspect something, can immediately say, you need to pull up and I need to see your face immediately, and if they don't, then that's reported and that's dealt with pretty punitively at the court level. So there's, and as we learn those different things, I think that's important to note. But they've just been great. And what we want to do now, and I'm just going to say in the interest of time, the great thing about having this videotaped is we're going to be available after this session ends, but I want every question, whether you verbalize it or whether you write it down, get that to me, because we're going to put ask questions on our link as well, so anybody that looks can see all the questions asked, and we'll give hopefully a really good answer for you. But we want to get you out of here on time. So I'm going to start, and I'll probably restate your question for the video, and then I'm going to let an expert answer, and this gentleman here.
If people want to be on audio, and you're in a group, can you have several of them audio at the same time, or is it only one-on-one?
So if we want to be on audio and we have several in a group, does it have to be one-on-one, or can you be doing that effectively in the group setting? I'm going to let Jared speak to that.
We can do audio as a group. We are limited a little bit with bandwidth or connectivity, the speed of the internet. So if we have a whole group on audio, we can do that with several individuals, but we couldn't have a group of, let's say, 20. Maybe something more like 6 to 9 people. And one-on-one is very easy to process that audio.
And just to follow up with that, because their identities are hidden, are their voices covered, so then that doesn't connect their voice with the individuals, or can people hear their actual voice and somewhat recognize that?
So there's confidentiality with the avatar and the name, but if they're doing voice to voice, is that anonymous as well?
It is pretty anonymous. There's one glitch with that. There's one problem. We recommend using this device here, so everybody else's voice is going right into a consumer or a counselor's ear, right? Rather than being kind of broadcasted. Because, for example, some of our consumers will go to McDonald's or a coffee shop to get on the internet, and we don't want all of our consumers' voices, even though their names are not recognizable. Well, somebody might have a unique voice and live in a small community, so we don't want that to be kind of broadcasted at McDonald's. So individuals do have to agree to use these, but at the same time, if I'm using one of these and I'm talking about my problems while I'm sitting at McDonald's, I don't want everybody around me at McDonald's to hear, because as I'm talking with this headset, everybody around me is hearing what I'm saying too. So it's kind of a confidentiality, well, more of an anonymity issue for me at that point. So it's kind of based on an individual basis at that time. But what we do is, with a group, it's either everybody's audio or we're all chatting. It's kind of one or the other. So we're not going to have some people in voice and some people texting, because there's a big separation in communication that way.
But the voices within the group aren't masked in any way.
No, they're not like, there's no like changing of the sound or anything like that.
I think that was really the point of the question.
Oh, was it? Well, you can have all that other information I just gave you for free.
I just wondered, because they hide themselves to the other clients, but yet if I was on there, I'm sure everybody could identify that that's my voice.
Yeah.
And so then they're going to connect me with my hidden identity.
And that's a brilliant idea. I've never thought of that. I've never heard of that. But masking voice.
Where everybody just sounds the same.
Yeah, I'm taking a mental note.
And just real quickly, percentage that do text versus voice, about guesstimating?
Mass majority text.
And as the technology evolves, that's good things to consider. My great friend Mike Smith back here has a question.
It's kind of tied in the same way. I think everybody has interests of security, HIPAA, all of that stuff. With the computer, questions I have, okay, they have access to the computer. What type of computer is it? Can they, like, I own a probation company, you know? Can they access child pornography while they're using that computer? How long do they have the computer? Do they give that computer back to you? Do you sweep that computer before you give it to a new one? Those kind of things.
Those are all yeses. Those keeping track. Yes, they can abuse the equipment. They can break it. They can access inappropriate content. They do give them back most of the time. Sometimes we have somebody relapse. They might pawn the computer. They might break it if we know it's something. Now, once again, there's only a couple of programs where we provide the computer. Other programs, they have to provide their own computer. And we can't, there's really no effective way to police what they access using that computer. And they can really go and abuse any computer anywhere, anytime, anyway.
And we started out with some programs where you had to have a special computer to even be able to get onto this platform, and we provided those through federal grants. We've moved now to a web-based platform where, whether it's your iPad, your laptop, and we're really moving toward it's their computer as opposed to us. I think that's funding streams, and whether the federal SAMHSA grants have the money in the future to provide those type of computer technology. But that's a great question.
I want to go a little bit further for you, Mike. We had an instance, and I think in our last meeting, when I came out and saw Judge Walker as well, we talked about putting them all assigned passcode protected. So with any type of inappropriate use, the actual participant or offender would be sanctioned for it. What we ran across and why we addressed it this way is we had an individual whose child was logging on while the mom was at work and downloading YouTube music videos, which was using up the massive amount of streaming and things like that. So now going to where we're going to assign passcodes, if you give that out, you're responsible for it. You should hold on to that like it's your PIN number on your ATM card. We also, if we even suspect that there was something, our counselor will come in, drive in, sit down with them, and they'll go through their cookies and everything else. And of course, our participants think if they delete that, oh, I'm good. Well, no, because they go in behind the scenes then and they're able to pull all that information as well.
Mm-hmm. And to add what Christie just said, I'm always watching. So I have a couple cool little pieces of software on my computer where I can pull up any screen of any one of our registered users. So, and I can see what's on their screen. And courts love when I do that because I bust them. I bust them on bad websites or gambling websites, so on and so forth, and misusing the computer based on the agreement that they've signed. Furthermore, one more quick thing that's I think important that has been a common question for a long time, and that is, how do we know, and it's been touched on a little bit but not directly, how do we know that the person on the other end of the computer is the person that we think it is? And in that case, we use Skype. Most of us are familiar with Skype, right? So we've created a new guideline, kind of a new procedure in the past year where we're doing Skype checks. And how we do that, Judge Cotton Walker kind of helped put this together, and that is we have them Skype in before a service, whether it be a group or an individual. And then at a varying time throughout that service, the counselor will Skype that consumer back, and they have to answer. And if they don't answer, then that session does not count. And we can see them audio and video, and we know that it's them.
In the interest of time, I want every question that you have, write it down or come up here and let us know. We'll get that on our web link when we have the video edited and ready to go. And Jared is going to fly. Jared is going to fly. Go out and over the ocean. Go over the ocean. There you go. So.